Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe my channel and also please give your valuable comments. And also visit the playlist. In the playlist I have given all the topics which is discussed so far in a systematic order so that it is quite convenient for your study. So anyway, my dear friends, we were discussing about autism and Ayurveda. So in the beginning, we are dealing with the normal introduction of autism and understanding of the autism in the present day practice. Then we will look into the Ayurvedic concepts. So in the last class, already we have covered 3 or 4 parts. So today we will discuss about the clinical course of autism. The basics we have already seen in last 4 parts. Now we know that autism is basically a lifelong disorder. This has to be understood unless it is identified at the very earliest part before the complete development of the neurological system. Otherwise, this is to be considered as a lifelong disorder. The affected families need to support throughout the life. Now the baby is affected by the autism. The family must support this baby throughout the life. That means that baby needs some assistance throughout the life. Although there is scope for some improvement if it is diagnosed earlier. Otherwise, this baby needs a continuous assistance from the family throughout the life. So basically this is a neurodevelopmental and as well as neurobehavioral disorders which persist throughout the life. The problem is there will be neurodevelopmental and also the problem will be there with the behavior, and therefore basically this affects throughout the life. The problem will be there throughout the life. Usually autism will be typically recognized at the second year of the life. During the second year of the life, when actually communication skill will go into develop, social development will go into develop. In that time, if the baby is not able to do the same, then usually this disease is get diagnosed. Usually autism is diagnosed in the preschool year, whereas ADHD will be diagnosed in the school year. In the school, actually ADHD is diagnosed perfectly, whereas autism is diagnosed a little earlier, maybe in the preschool years. Usually by 12 months, we know that normally in any normally growing child, when in the 12 month, that means in the first birthday, a child should be able to respond when the name is called. Suppose when you are calling the name of the child, by 1 year, end of the 1 year, usually child respond either by turning the face or turning towards the source of sound, or maybe sometimes showing by body gestures, or sometimes it may respond for that, or sometimes it may respond by means of smile or anxiety or something like that, or any other non-verbal communication will be there in a normally growing child at the age of 1 year when you call the name. Okay. And usually a normally growing child, so it will say his name, his or her name by the end of 18 months. 18 months is almost 1.5 years. So 1.5 years, the child is able to repeat his name. What is your name? When you call, he is able to repeat it, or he will try to repeat it. So this is a normal pattern which is seen in normal babies. When this pattern is not seen, child is not responding for your voice, child is not turning towards the source of the sound, or child is not able to do the eye contact, then these are some of the issues which made to diagnose the autism at that particular age. So usually diagnosis will be diagnosed by 2 years if the mother is very caring or she is supervising the baby normally. So later this is a problem which occurs in the early part. Later in the childhood, so as a child grows further after 3 years, 4 years, 5 years, 6 years, now the problem will be there because of autism due to the delayed development and language and unusual play and as well as behavior. As the child grows older, okay, in the school years, so what actually is the problem will be there because of the delayed development. Now there is a delayed development of the social domain, there is a delayed development of the language, there is delayed development of the communication, and there is a delayed development of the or problem in the behavior. So these are the issues which affect the baby or create problem to the baby in the early childhood. Okay, so what I mean to say is this disease is throughout the life. In the early part we have seen, in the early childhood these are some of the issues that we need to tackle, and in the middle and late childhood, maybe 10 years and all, So there is a lot of school issues. Now school issues, you have got a lot of complaint from the teacher that the child is not able to concentrate. The child is not at all receiving what we are, his perception capacity is very less. Okay, so he is not mingling with the other students, and he is not showing the eye contact, and she or he is simply sitting without giving any response. These are all, some of the complaints from the school teachers. So in the middle and as well as the late childhood period. The same child, when he get into the adolescence period, there will be onset of some of the psychiatric illness, and some of the adolescent issues will be there. Now adolescence period is a period where the hormonal hijack will be there. So a lot of hormones are produced that create a lot of changes physically and as well as psychologically. In a child with the autism, which is already having autism, he has got a lot of issues, and this particular adolescence period may create some more problems. Okay, so there may be some psychiatric issues, or some maybe some other adolescence issue. Sometime may be possible the child is expressing his what do you say, hormonal the changes in the form of the sexual development, etc., or sexual desires, etc., in a different way, which looks very odd for the parents. Okay, so these are some of the issues that we can face, we have to face, we may face in adolescence period. Similarly, the same child, when he become adults, so there are so many other issues for autism child when he become adult. One of the main thing is unemployment. Okay, so there is a lot of issues related to the job and all, because he is not able to perform any skillful activities, or he is not able to communicate. So the unemployment is one of the issues. Then relationship, another issue. He is not able to maintain the relationship with the co-fellows or colleagues, or with the family friends or family relatives, etc. Another is he is not able to live independently. He always need assistance. As I told earlier, he need always assistance. Okay, so these are some of the issues even when he become an adult. So therefore, in the beginning I told that basically this is a disease which is a lifelong disorder. Okay, the percentage of autism may be 80%, 90%, or 20%, or 10%. He may not have all the symptoms which should be there for the autism, but he may have less symptoms, he may have moderate symptoms, or he may have severe symptoms. Depending on that, the quality of the life will going to change. Otherwise, if the child is only autistic by 10%, suppose only few things are there, other things are normal, suppose if that is the situation, okay, child may have a very good better life. Okay, better life may be there. But unfortunately, if the child has got more symptoms related to autism, there is more involvement of the social milestones and developmental milestones, so behaviors and language milestones. Unfortunately, child may have some pitiable life in the future. Now, these are some of the basic things which you have to know about the autism before going to the exact topic of the autism. Till now, we have not touched the actual topic of the autism. I'm just giving the general introduction regarding autism. So in the next class, we will start with the approach to a case of autism, and how we have to deal with it, and how we have to suspect, and how we have to manage. So that we will discuss in the next class. Thank you very much for being with me, and please don't forget to subscribe my channel, and also please give your valuable comments. Thank you very much again.